Now, we'll mention esophageal cancer itself. Let's start with a question. Is squamous cell cancer or adenocarcinoma more common in the United States? Well, it's adenocarcinoma, and let's explain why. Barrett esophagus, of course, is a risk factor for esophageal cancer, but you can also develop this condition through alcohol use, achalasia, cigarettes, diverticuli, esophageal webs, esophagitis, or more uncommonly through hereditary familial mechanisms. The cancer generally presents as progressive dysphagia associated with weight loss. Dysphagia in an older individual with heartburn should make you suspicious for esophageal cancer. And if you see dysphagia in an older person with heartburn associated with weight loss, 100 times out of 100, you're dealing with esophageal cancer. Worldwide, squamous cell cancer is the most common because squamous cells are the usual lining of the esophagus. In the United States, what is the most typical risk factor? Well, in the US, the most typical risk factor is Barrett's esophagus from GERD. Once those cells have undergone metaplasia to intestinal columnar cells, the cancer develops from them is adenocarcinoma. GERD is very common in the US, and the other causes are increasingly rare. So most cases are adenocarcinoma in the United States. Since Barrett's occurs in the lower region of the esophagus just above the stomach, it's not difficult to see that adenocarcinoma is in the lower 1/3 of the esophagus, while squamous cell carcinoma is generally in the upper and middle 2/3. You can remember the various risk factors for esophageal cancer with the mnemonic A, B, C, D, E, F, G, H, which stands for alcohol, achalasia, Barrett esophagus, cigarettes, diverticuli, esophageal webs, familial, fat or obesity, GERD, and hot liquids. Squamous cell carcinoma risk factors include alcohol, achalasia, cigarettes, and esophageal webs, as well as diverticula. Meanwhile, adenocarcinoma's risk factors include Barrett esophagus, being obese, and GERD. Now, let's discuss gastritis. What's the definition of gastritis? Well, gastritis is any condition with inflammation of the mucosa. There are two main categories, acute and chronic. You're probably more familiar with the more common chronic gastritis, which is non-erosive. However, acute gastritis can also occur, and when it does, it is actually erosive. Many patients develop acute gastritis, often simply referred to as stress ulcers, and there are two named versions. The first is a curling ulcer, which is related to burn injuries. The way to remember this is thinking of a curling iron. The curling iron is hot, 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 and it burns. In the curling ulcers, the loss of plasma volume due to the burn can by itself cause sloughing of the gastric mucosa. The second type of acute gastritis is Cushing ulcer, which is related to brain injury. An easy way to remember this is that you should always cushion the brain. And in Cushing ulcer, patients with brain injuries can have increased vagal stimulation, which leads to more acid production by high levels of acetylcholine, remembering back to GI physiology. For this reason, most ICU patients are given proton pump inhibitors as part of their daily meds. Now, let's go over the other things that can cause acute gastritis. The other main causes are severe stress, NSAIDs, alcohol, and uremia. Remembering back, what do NSAIDs block production of? Well, they block production of prostaglandin E1. In a patient taking too many NSAIDs, there isn't enough prostaglandin, which is necessary to protect the gastric mucosa. Next, let's mention the more usual chronic gastritis. Type A occurs in the fundus and/or body of the stomach. Type A happens to be caused by a number of conditions that start with A: autoantibodies to parietal cells, pernicious anemia, and achlorhydria. Remember, achlorhydria is low production of gastric acid. Type B, affecting the antrum, is really the most common form of gastritis. It is caused by H. pylori and is generally easy to treat with combination antibiotic regimens. If it is untreated, there's an increased risk of malt lymphoma. Remember, malt lymphoma is a form of lymphoma involving the mucosa-associated lymphoid tissue, or MALT. The mnemonic here is just the reverse. The B, bacterium, affects the A, antrum. Interestingly, those that go on to develop malt lymphoma can potentially see an improvement in their symptoms and cancer if they receive antibiotic therapy to eradicate H. pylori. Imagine that. Antibiotics can help cure cancer. A mnemonic that may help you is A comes before B. Type A affects the first parts of the stomach, and type B affects the second parts of the stomach. Now, just a brief mention of Menetrier's disease. This is a condition of gastric hypertrophy that has protein loss, parietal cell atrophy, and an increase in the number of mucus cells. It is also precancerous. The rugae of the stomach are so hypertrophied, which you can see here, that they are described as looking like the gyri of the brain. It is a rare variant of gastritis and is not heavily tested, but it's good to keep this characteristic image in mind. Next, let's talk about stomach cancer. Stomach cancer is almost always adenocarcinoma. This is an aggressive tumor that spreads locally early on. So where does it frequently metastasize to? Well, it frequently metastasizes to lymph nodes and the liver. The first sign of the disease might actually be acanthosis nigricans, which you can see here. It's a grayish-brown discoloration of skin regions, notably in the axilla, which is this picture, and the neck. An important epidemiology point to make is that this type of cancer is more common in Japan than in the US. There are two types of stomach cancer. The first, the intestinal type, is thought to be a result of metaplasia of gastric mucosal cells to resemble intestinal cells. It usually appears as an ulcer with raised margins and is commonly located on the lesser curvature. What is the intestinal type usually associated with? It is associated with H. pylori infection, ingesting nitrosamines found in smoked foods, achlorhydria, chronic gastritis, and type A blood, as well as smoking. The second type, or diffuse, on microscopy you may see signet cells, which look like rings, which you can see here. And on gross pathology, you might find linitis plastica. What is linitis plastica? Well, it is a thickened, rigid appearance to the stomach lining. This is not associated with H. pylori. This is an important point to remember. Some frequently tested facts are this image, which is Virchow's node. Virchow's node is involvement of the left supraclavicular node that may be the first sign of disease, which you can see here. This is because the cancer spreads throughout the lymphatic system from the stomach and drains into the thoracic duct, which ends in the venous system at this location. The Krukenberg tumor is when stomach cancer metastasizes bilaterally to the ovaries. Finally, the Sister Mary Joseph nodule near the umbilicus, which you can see here, can be felt subcutaneously and is another common location for stomach cancer metastasis. Time for a quick flash quiz to review. True or false, Menetrier's disease is a precancerous condition? That's right, it's true. There is gastric hypertrophy which can lead to cancer.